Now, the World Health Organization has warned that nearly 90% of African countries will miss their target of vaccinating a tenth of their population by September. The WHO says at least 225 million jabs are urgently required if the majority of the countries on the continent are to meet the deadline. Professor Tumbi Dungu, Deputy Director at the Africa Health Research Institute and member of the COVID Research Consortium, joins me now to talk more on this. Professor Dungu, good afternoon and thank you very much for your time. This announcement by the WHO, of course, coincides with the United States now announcing that it will donate about 200 million vaccines to low and middle income countries. A coincidence, maybe?
Yeah, perhaps a coincidence. Thank you very much, Tabo, for having me on the show. I think it's good news that the vaccine rollout is ramping up, but I think still we are very much behind schedule. I think that the vaccine rollout needs to move much faster than it is. So far, less than 500,000 people in South Africa have been fully vaccinated. So it's good progress and it's good news on the horizon that these vaccines will be available, but I still feel that we could be doing much better in terms of vaccine rollout, because it's really the only way and the most efficient way for us to stop this pandemic.
Only 7 out of 54 African countries are likely to reach that target. What are the 7 doing that the rest are not?
I think much better organization of the healthcare system. And what we have seen with this pandemic is that even countries that are low in resources, you can get yourself organized if you take this pandemic seriously and put mechanisms in place, healthcare mechanisms in place to really make sure that you distribute the vaccines. If you just take it as business as usual and don't pay special attention to both the acquisition of the vaccines, but also the rollout of the vaccines in terms of the logistics that are needed to roll out the vaccine widely, including the cold chain and organization of how the vaccine will actually be administered in all corners of the country. And if you don't do that, even when you have resources, you will find yourself lagging behind. So I think what it is telling us is that even in Africa, there is a lot of, shall we say, differences from one place to another in terms of the way people are approaching this vaccine rollout, with some countries having much better plans of rollout and of acquisition of the vaccine. And for those countries, it is working very well.
Are we at the mercy of wealthier countries, and the WHO urging wealthier countries to share vaccines at this particular point? I mean, only 1% of over 2.1 billion doses administered globally were administered in Africa. And if you look at the acquisition of vaccines, at least in the last couple of weeks, has literally been at a standstill.
I am afraid that at the current time, yes, we could say that we are at the mercy of these rich nations. We simply don't have the vaccines. We haven't manufactured the vaccines. We haven't had the capability to manufacture these vaccines. We don't have the intellectual property to rapidly make these vaccines. So we have had to rely on richer countries, and we have to admit that that is the case. And I think one of the lessons of this pandemic is that we must ramp up vaccine research and development capabilities within sub-Saharan Africa, so that, and within Africa as a continent, so that if we have to face such a pandemic or such a situation in the future, we can have the capability to do that. Yeah, so for the time being, I would have to say that in the short term, yes, we are dependent on these countries to get the vaccines that have been certified to be working out there.
How important was that 10% target that was set by the World Health Organization? What would it mean for the health of African countries?
I think it's important. You know, I think what we've seen with this pandemic, and some of it is obviously anecdotal evidence because the data we haven't had reliable data in all the African countries, but there does seem to be less severe disease caused by the virus in Africa, which then gives us a window of opportunity, so that even if we were to vaccinate less people within the population, it gives us a chance to get ahead of the virus in terms of the people who could become severely sick. So although I think this is a low target, I think it is useful to start with, and given where we are in terms of our technological ability to make vaccines and to distribute vaccines, I think it is a good target, and it gets us going. So if we can achieve that, I think it will be tremendous progress. We just need to make sure that, in fact, we can achieve that, because sometimes you set these targets, but even achieving those targets, even when the bar is low, you find that it is not always that easy. So I think it will help us to move in the right direction in terms of dealing with COVID-19 in Africa, but we certainly need to do much better and move very fast.
You know, the G7 nations are meeting currently in the United Kingdom. What should they be talking about?
I think that COVID has to be at the forefront of what everybody is talking about. In particular, the availability of vaccines for the resource-limited settings. I don't think that we should be having to lobby. The thing is with this pandemic is that if we don't protect one part of the globe, if we feel that Africa should be left on its own to fend on its own and not protect Africa from COVID-19, what you're going to find is that this virus will come back to bite everybody, because what will happen is that you will have mutations arising, and you will have new variants of concern, most likely developing, that will then spread to other parts of the universe, of the globe. And what you will find is that some of these might be resistant to vaccines. So I think that the G7 countries need to take this seriously. They need to make sure that Africa and other resource-limited settings in the world get access to these vaccines as quickly as possible, just like people in rich countries, because we are having an emergency situation.
Yeah.
And then we can, from there on, obviously, we can start thinking about how do we develop the research and development capabilities in Africa.
Professor Tumi Ndugu, appreciate your time, and thank you very much for joining us. Deputy Director at the Africa Health Research Institute and member of the COVID Research Consortium there, joining us for that conversation.